Definition and description. Frozen shoulder, also known as adhesive capsulitis. It is characterized by stiffness and pain at shoulder joint that restrict shoulder movement. The term frozen is the less use of the shoulder, causing the shoulder capsule to thicken and become tight to move and frozen in its position. People that are recovering from a medical condition or procedure that limits the movement of the shoulder are at higher risk of developing frozen shoulder.
Next is incidence and prevalence. The incidence of frozen shoulder among general population is about 2% to 5%. It also stated that 40 to 60 years old as a peak incidence for developing a frozen shoulder, and outside of this age of the group are rare. High prevalence for the African American and Hispanic. Women are more often affected compared to men. It shows through a percentage, which is women have a 10.1% of developing frozen shoulder compared to men that only have 8.2%. The common diseases that associate with frozen shoulder are diabetes. It shows that a lifetime risk for developing frozen shoulder among diabetes are 10 to 20%.
The etiology of frozen shoulder. First, age. People range from 40 to 60 years old are more likely to develop frozen shoulder. Second, diabetes. Third is immobilization. Lastly, other diseases. Some diseases associated with frozen shoulder include hypothyroidism, Parkinson's disease, and cardiac disease.
There are basically 3 stages of frozen shoulder, which are the freezing stage, followed by the frozen stage, then lastly the thawing stage. During the freezing stage, there will be shoulder pain which worsen at night. People affected will slowly lose their range of motion, and the stage will last between 6 to 9 weeks. Histologically, there is perivascular synovitis and disorganized collagen deposition and scarring at the capsular tissue. Next, for the frozen stage, it is said to be less painful, but stiffness of the shoulder remains. This stage will obviously abrupt daily activities of affected people due to limited range of motion, which will last between 4 to 6 months. For the histology of the frozen stage, there is dense and hypercellular collagenous tissue of the capsule. Then, during the thawing stage, which is the last stage, the shoulder will slowly improve where its strength and motion will completely return to normal or close to normal. Feeling of pain may fade, but occasionally recur. This stage will last between 6 to 24 months at least, and there is fully developed scar tissue of the shoulder.
Let's move on to the pathophysiology of frozen shoulder. For the first stage, there will be inflammation occur within the joint capsule and synovial fluid. Then, followed by the reactive development of adhesion and fibrosis of the synovial lining of the joint, which is caused by the increased number of collagen. And lastly, the thickening and contraction of capsule development, which further limit the range of motion of shoulder in all directions.
The prognosis of the frozen shoulder. The prognosis for recovery of the frozen shoulder remains uncertain. Frozen shoulders tend to get better, although full recovery may take up to 1 to 3 years. However, people with frozen shoulders may not regain their full range of motion. Lastly, people who get the treatment for frozen shoulder have a shorter recovery period compared to those who left frozen shoulder untreated.
Alright, we'll continue with the management of frozen shoulder. The treatment of frozen shoulder goals are to restore function and manage symptoms, which can vary with patient factors, stage at presentation, clinical preferences, and local policies or funding. There are 2 types of frozen shoulder treatment, which firstly is a non-surgical treatment, or also called as conservative management. This treatment is a preferred choice of treatment, which most patients will improve between 6 to 18 months. Other than that, surgical treatment is also one type of frozen shoulder treatment. These are the examples of non-surgical treatment, which we can see there is physical therapy, injections, and pharmacological treatment. Other than that, hydrodilation and suprascapular nerve block are also examples of non-surgical treatment. For surgical treatment, there are 3 examples shown here, which are manipulation under anesthesia, arthroscopic release, and open release.
Now, let's move on to impairment and functional limitation according to International Classification of Functioning, Disability and Health (ICF). As the disorder is frozen shoulder, the patient tends to have impairment of their body function and body structures, limitation in doing the activity, and lead them to have participation restriction. For their impairment of body function and body structures, patients tend to have stiffness around the shoulder joint, shoulder capsule thicken, become tight to move and frozen in its position, pain with any shoulder movement, it will worsen at night, limited range of motion, inflammation will occur, development of adhesion and fibrosis of the synovial lining, and thickening and contraction of capsule. Due to the impairment of body functions and body structures, they will have difficulty in doing activities of daily living. They will have problem when doing self-care, difficulty to sleep at night, and difficult to dress and undress. For the participation restriction, they will have less socialized with friends and acquaintances and can participate only in activity that does not primarily use shoulder. Environmental factors and personal factors also included in the ICF. For environmental factors, the affected site is sensitive at night and they may have less support and relationship from friends. Factors are describing patient's condition such as patient is female, 50 years old and she has medical history of diabetes. Due to her diabetes, she developed frozen shoulder and lead her to have limitation in doing activity and restriction in participation. Here is the overall picture of frozen shoulder based on ICF.